Hello, everyone. Welcome to our podcast. I am here with one of my beloved friends and longtime colleague, Dr. Julio Hernandez. And there's these people that just stand out to me that are just such an amazing success that have been in my life personally for so long. So thank you so much, Dr. Julio Hernandez, for being here with us today and sharing some of your journey and your insights. So I know that we have a special celebration going on. You can tell us all about that. But first, let's kind of discuss like how you got into incorporating aesthetics into dentistry.
Yeah, it started like, well, first of all, thank you for having me. And I was like really excited to be part of this journey with you because I've seen you grow also with your company for so many years. So we've been really been growing together. I got into facial aesthetics like 16 years ago, which seems like a really long time, but I started working, I always had my dental office, but I started working in another location that was actually like a plastic surgeon office, and they were doing cosmetic dentistry and anti-aging medicine. So it was like bringing everything into one location. So basically my patients that were getting dental work were then going into the room next door and getting Botox and fillers. And of course I would like sometimes walk them over there. I would stay in the room and, chat with the plastic surgeon and the patient. I was like, oh, this is kind of cool. I worked there for a couple of years. I ended up coming back to my office. So then in 2008, basically I started like, taking some basic Botox and filler courses. And at the time, it was a very novel idea for a dentist to be doing Botox and fillers. So I
Yeah.
even got
I
some
started in
press about like the
2006.
Botox.
So yeah,
Yeah,
2006,
yeah,
2007 was when started doing
yeah,
courses, and it was very, very new. It was just
yeah,
very cutting edge, dentists going out
right.
and doing that. There was like no regulations, but yes, so that's why I
Yeah,
love having
yeah,
you here because you were in it from the start. So now you're in
yeah.
2020, you start taking courses, and what happens?
Yeah, and basically, obviously what I find is that patients, they know you, they trust you, right? Obviously, dentistry is very personal. So to get into somebody's mouth and work, blindly when patients have to like really trust you, it was an easy transition to do Botox and filler because they already know me, they already trust me. They don't ask me what courses I've taken, whatever, right? They just ask questions. Oh, do you do this? And then being able to answer those questions honestly and intelligently, right? They're like, oh, this guy knows what he's talking about, right? So for me, I've
Exactly.
always been the person that I've always wanted to learn more. I always take courses. I'm always like educating myself, and I
Yeah.
never touch the patient for the first time until I know everything about like everything I could learn. So like even though I took like a weekend Botox course, I probably took like 3 other courses, did videos, did like read a book, and then I saw my first patient. And my first patients were really my staff, my family, I did all of those people first. And then I actually started like, seeing my own patients in the office. And it was a really it seemed very, because I was doing so much cosmetic dentistry, it just seemed very synergistic for, to incorporate aesthetics into dentistry.
And I commend you for the education part because that is something that over the years, I mean, you've taken countless courses with us at Dentaspa.
Yeah.
Tell us a little bit about how that helped you. I know you like a lot of you've become friends with instructors, and tell us a little bit about your journey taking our courses throughout the years.
Yeah, it really started with dentistry, right? Because I mean, I tell even like, I mentor like a lot of like young dentists coming through, out of school, and I tell them, it's like education never finishes, right? And if you're wanting to do something, you really have to know everything about it, right? And I had that passion for learning like
Mhm.
early on in dentistry. So when I basically started taking something as new and so different to dentistry as facial aesthetics, right? To me, is like, okay, I'm going to be judged like next to a dermatologist who's had schooling, who had like knows about skin and acne, and people are going to ask me all kinds of questions. So I really had to like learn, because I don't like to be asked a question and be like, I don't know. I want to
Yeah.
have, I may not know like the full answer, but I need to have some basic knowledge. And this was way before like Google and like things that's so easy, like you could like go and chat GPT everything, right? This is
Right.
like years and years
But
before
but you know the value of
accessibility.
hands-on because you've
Yeah.
always
Oh yeah.
been coming out to the courses to do
Yeah.
hands-on training and
Yeah.
perfecting your skills. And not just that, but like you said, new techniques come out. And so you're constantly like, Anna, like, I want to
Yeah.
learn this. I want to do that. I was this in
Yeah.
advance, advance.
Yeah.
So, tell us a little bit about your experience at Dentaspa, since this is our Dentaspa Injector podcast.
Yeah.
A little bit about what your journey with us.
Yeah, it's been incredible, really, because at the beginning, when there wasn't really a lot of courses to take, and you're basically in a room full of nurses and doctors, and they're like, you kind of have to like, stay quiet that you're a dentist, right?
It's not
Just having
customized
like,
to you, yeah.
yeah, just having like your group of people that are dentists and they have like your same training and like your knowledge, and then being able to share like some of that. And one of the things I tell people that are like getting educated, like you said, hands-on is so important, but then just going out and doing the work right after, right? Because I could go to your course, it's an amazing course. I could do a hands-on course, but then some people are so timid they don't actually go back to work on Monday and do anything. I was like, you gotta
Right.
like grab your sister, grab your front desk, grab anybody, and start doing what you just learned because it's fresh in your mind. So I learned that a long time ago, and I probably learned it from you and your instructors, and it's been so valuable, really. And what I find so great about the IAFA symposium that you do every year is that you bring really like top doctors from like around the globe, really, just like learning different things. And there's so many things that I was just there, I wasn't really planning on, like buying a laser, for instance, or doing like PRF. That wasn't even on my radar. But then I hear this lecture, I was like, oh my God, that's fascinating. And then I just want to learn more, right? And that just expands your knowledge, your list of services. I'm able to offer so many more things to my patients. So I mean, education to me is like so important. And the way you have it set up is makes it so easy, because you go through like, step one and
Dentaspa
two, and
courses, yeah.
yeah,
Yeah.
all the courses are numbered. So a lot of people are like, where do I go? Where do I start? What do I do? I was like, sign up for Dental Spa. I mean, it's like, it's a no-brainer. They've kind of like, you figured out like what the journey should be, and then you just take that journey, right? Like you can't go in and start doing like advanced treatments from day one. No, you start
Right.
like the basic, and most people are really like, they don't need advanced things, just
Yeah.
it's an easy journey to take, and you make it really easy, and your symposiums are really like top notch.
Thank you. Yes, for the listeners here, we have Dentaspa, which is curated, as Dr. Hernandez says here. We have not sold out. We are an academy that we are designed for dentists. So the IAFA is our supporting academy, which is multi-specialty, and that's for everybody and anybody who's an injector. But the beauty is it's set up to support Dentaspa. So Dr. Hernandez, as he knows, there's a lot of dentists that have been injecting for years that come to this meeting. So it's just a beautiful, and that's where you find all the innovation and the new, but you can find comfort in knowing that in Dentaspa, you're going to learn, very easy ways to integrate these treatments without getting too crazy, because there's always more to learn, right? But what we try to do at Dental is make it efficient, right? So you come to D1, you learn the cosmetic and therapeutic applications that are most popular, right? And then based on what you are kind of, in the direction, you can take a lip course, you can take a PRF course, you can take a facial sculpting course, et cetera, et cetera. And so that's what, we pride ourselves in, is creating that journey that's easy for them to do, but also know that even when they're done with all the courses, there's always a once a year meeting where they can pick up the latest and greatest things that are going on. I always like to ask this question: what do you believe is the most, and I'll ask this in two parts because I feel like sometimes this changes, but if you can recall back to when you first started doing injectables in your practice, what were the most, when you didn't have all the amazing skills that you do now, because now you're an incredible injector, been doing this for so many years, but a lot of the listeners probably listening right now are either just starting their journey or thinking about starting their journey. So what would you say were the easiest treatments to integrate, and the ones that you kind of started with that were like easy peasy, very, like you said, it's like a nice flow between dentistry and facial aesthetics, because we're right here, right? Most of the treatments are in this area. But do you remember what was like what you gravitated towards in the beginning before you got all fancy?
Yeah. Well, I'll tell you, I mean, obviously Botox, because it's easy. It's a simple injection, understanding anatomy. And really when basically Botox and fillers, right? That's like 101, right? That's like what
But
you
what
learn.
areas? Like, was there,
Placing
what
Botox
area?
in the,
Was it
yeah,
lips? Was it
yeah,
TMD?
exactly. I mean,
Was there a
no, I
specific
mean, for me,
treatment?
I mean, looking at just facial aesthetics, like the crow's feet, the forehead, the glabellar lines, right? Those like the primary places that we would place Botox. That's where kind of like what you learn in the basics on what everybody would do. The thing is, at the time, there would be a map that everybody would get the same exact treatment. And what you realize with time is that everybody's face is different. So you really have to customize the treatment for the
Right.
patient.
And then you
With
become a better
fillers, it's
injector.
very
Yeah.
safe to place fillers. Yes,
Right.
100%, right? And then you find like, okay, places to put it, below the, on the lower third, the lower two-thirds of the face, right? And the neck, and those are kind of like more advanced things. As far as fillers, placing fillers like to the bone is really the safest place to place it, right? So usually when most people lose volume is in that mid cheek and lateral cheek area, and really just like going down to the bone, injecting a bolus. I mean, just under like feeling what that feels like, how much product to inject, understanding the rheology of the product, placing it. That's kind of where we started. At the time, we were also doing a lot of nasolabial folds, which
Which
today is
sometimes
just
you
something we
need.
don't do. We
Yeah. You don't
understand
need as
how,
much. Right.
yeah,
Right.
yeah,
Yeah, exactly.
we don't do it as much. We just don't. We understand that the aging process better and how the products affect the face, right? So before we used to like everybody come in, everybody would get like nasolabial folds, and now it's like no. First we do lateral cheek, medial cheek, we lift everything, and then maybe come back and do a nasolabial fold. So
And what about,
the way the process is different.
of course, and what about like downturned mouth? Do you see a lot of patients that kind of have like that? Do you do combination of neurotoxins with filler to kind of lift this corner? I know that's a very popular
Yeah.
treatment in the industry as well.
Yeah, 100%. I mean, nowadays, I mean, I do everything, right? So, but if I think back, it's like that to me was always like something scary, right? It's like I know, like I went to a course, like I could do a crow's feet, but now when I'm doing that lower third of the face, I was like, okay, am I comfortable enough to do that, right? As a beginner, I would just do like the basic. Of course, this is an easy injection for me that I understand the anatomy, but really, I think one of the most important things I understood is really understanding the anatomy. We're taught anatomy more than any other profession, but we're taught in school. By the time you get out of school, I've been out of school 30 years next year. I don't remember what I learned 30 years ago,
Right.
but it's like refreshing that basically that knowledge basically constantly, right? And just looking at the anatomy and how to when I place Botox in this part of the muscle, how it works, and really understanding that. I mean, the courses that you give all of that information, right? So
And
it's
you've
not
taken the
something that you have to
cadaver
learn for
course as
yourself.
well, right? You've taken all,
Yes, of course,
yeah,
of course. Yeah. And these
yes,
courses are fascinating because every course you take, even as many years as I've been doing it, I'm still going back and taking courses. And, even the IFA, the symposium that you do annual, what's cool about that course is that you have super advanced injectors and really like brand new injectors. And everybody's learning in the same, because there's always like somebody has a different technique of doing the same thing that I've been doing for years. And you're like, oh, that's cool. I never thought about it that way, right? So I'm
right.
always learning something new from injectors, even injectors like way younger than me, that
Right.
haven't been doing it as well. But then maybe they went to a course or they tried something different because there's just a lot of ways to skin the cat, like they say.
I know, right? So as Dr. Julio Hernandez is saying, anatomy, 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 right? So that is something that
100%.
we touch on all of our courses, but if, we always recommend the cadaver workshop at the IFA because, it really gets in there giving you that confidence because ultimately it all comes down to anatomy, right?
Yeah, 100%.
One of the things I see as a consultant, a cosmetic, is I see that, sometimes doctors are very good about getting themselves trained and they go to all the courses and they're so excited and their technique becomes really good. But there's like a staff that's like, has no clue what is what and all that. So one of the things that we've been trying to do more, obviously we do a little business implementation in all of our courses, but it really takes a day dedicated to the team in order for them to really understand all the things they need to know, like in order for it to implement well into the practice. How important do you see having the staff understand and be on board? How important was that to your success now in your practice?
It's 90% of the success. I mean, as good as an injector as I am, is it, like, it doesn't matter, right? Because nobody knows all the courses I took. All they know is like when they called, they asked the question to the girl who answers the phone, and does he do this? Do you do that? And then like they have to like trust, right? Because they're not going to just like lie over the phone. They're going to say, oh yeah, I've seen him. He does it. He's great. He's got his soft hands, whatever, right? And
They
then
have their
they walk
script.
in and the assistant sees them. Yeah, yeah. And the assistant sees them, and the assistant's like, they're gonna ask the assistant, oh, I'm nervous, or what do you, and then the assistant's gonna make them feel comfortable. I'm the third one to see them, right? So by the time I see them, they're usually already sold. And if I have to go in and sell the treatment, then so I mean the staff training is super important, right? Getting everybody on board. I've made the mistake early in my career of going to conferences. I get back, I'm really pumped. I learned all this stuff. I come back, I'm like, staff is clueless. So what ends up happening is they just go to like business as usual, right? They just do the same things they're doing. They're not talking about the new procedures or the new treatments that we're offering. So I learned very early on. It's like I really got to get my staff involved, and I could tell them, I could teach them, but that's not the same as when they go to a conference and learn it for themselves. And they want to learn. I mean, they love the aesthetic things, right? And because everybody's asking about it. So when they get this knowledge, they're like so excited, so pumped. They're more pumped than I am. So they're like, oh, do you know this? Do you know that? How do you do this? So they forced me to like take more courses. Can I
Right.
go? This is what I always get.
Would you say most of your patients for facial aesthetics started off as being your dental patients in the beginning, right? So they were you were
Early on, for sure. Yeah.
yeah. Now I know
Yeah.
you kind of get more, but how have you seen the facial aesthetic patients then lead to more dentistry? Do you see this coming back and forth where it kind of helps you grow in both ways? Because I feel like that, I want my listeners to understand the impact that it can have on both sides of that at practice.
Yeah, when a patient, it takes a lot for a patient to walk into the office, and I think us as doctors, we don't fully understand like the journey the patient goes through. That they have to Google and they look and they read reviews, and then they finally like say, okay, I'm gonna call this office, and then the girl answers the phone and they like what they see, and then they actually find parking and get into the office and like walk in and get upstairs, and then by the time like you win them over, like they're sold, right? They don't ask me like what school I went to, what courses I took. They basically just ask questions. How can you help me? Do you have enough knowledge basically to help me? So like I have this problem, and what's the solution? So I basically talk about it. I sound intelligent because I know what I'm talking about, and they're building up trust, right? So that doesn't really matter whether I'm doing dentistry or facial aesthetic. I could do plastic. I could tell them about plastic surgery. They're like, okay, when can I schedule surgery? They have no idea, right? They just trust you. And when they trust you, the door is open to do whatever it is. And it's really just like the staff, oh, by the way, do you know we offer, like if it's a facial aesthetic patient, oh, do you know we also offer dental surgery? Oh, you do? That's amazing. Can I schedule a
So you
cleaning?
make it from
I
the
mean, because
start.
they're just,
Yeah. So from new patients there, you already incorporate something that lets them know that you're doing also the facial aesthetics, right? It's kind of
yes, for sure. Yeah, for sure. What I find is that patients that come in as dental patients, they want to know dentistry, right? They have like dental questions. So I can't bombard them with facial aesthetic because it's like that's not what I'm here for. So for me, it's like I always come in, I have to build the trust first. Like, hey, this is who I am. I'm here to like solve the issue that you came in with, which is a dental issue. And then once they feel comfortable that I could resolve their issue, then I have to say, and by the way, we also offer these services. So it's really like the timing, and that actually took me a while to figure out, because I'd be like, oh, I offer this, I offer that, and they're looking at me like, is he crazy? I didn't come for that, right? I
unless the
came for,
treatment, unless the
yeah,
treatment is directly related, right? I'm sure that you have some
right,
dental cases
exactly,
that
yeah,
requires a little bit of managing of the muscles for TMD, right? How
yeah, for
popular is that
sure.
in how popular is that in your practice, and how have you seen it help your dental cases from potentially, going south because
Yeah.
those muscles
And it's,
are get
yeah,
in the way.
yeah, I do a lot of TMD, partly because I've been doing ortho for a long time. So I do Invisalign. And really what I found is that TMD market exploded during COVID. everybody was stressed out. Everybody came in pain. And then I started seeing like, I'd say, maybe a patient a week, one every couple weeks. And it went from that to like 2 to 3 a week to like now 2 a day. I mean, I'm like
Wow.
seeing so people Google and I'm like, I come up #1 on the map as far, and I get referrals from like all these other doctors in the area that don't know how to treat TMD. And it's simple. I mean, a little Botox in the muscles is like, you could like literally like throw a dart and like get the muscle. I mean, it's not complicated, right? But just again, it's just like getting trained and knowing how to, and patients are in pain. So you're getting them out of pain and emotionally they're going to feel better. So you're doing a huge service for the patient, right? So Botox, even though it's obviously known for cosmetic, has so many applications for pain, and it's really, it's life changing for so many.
Yeah, absolutely. Do you ever do gummy smiles in your practice?
100%, yeah, for sure.
Yeah.
I've done everything. I've done, I'm celebrating 25 years that I've
Yes.
opened my practice just yesterday.
Congratulations.
So I'm really excited about that, and I can't imagine that this has been such an incredible journey. And when I look back at like old pictures and all the things I've done, I'm just like, I've done everything. I've gone to so many courses, so many things. I've dabbled into like literally everything. So
Well,
yeah,
congratulations on
it's
25
beautiful to like
years.
learn something and like yeah, thank you.
So you still do injectables within your dental practice rooms upstairs, correct? So you have
Correct,
multiple
yes.
laboratories. Dr. Hernandez here has a gorgeous office here in Miami, Florida. And so proud of him because he actually opened up his mini med spa on the first floor of his dental practice. And it's called Vicari. You can probably see the logo here in the background. Tell us a little bit about this venture because it's exciting. It's a gorgeous space. And tell us what led you to was it the evolution of having enough patients within your dental practice that you were already kind of integrating into facial aesthetics that led you to do that? Like, what was the vision behind Bicara?
In Florida, we're limited to only treating the patient basically from the neck up, which allows me to do a lot of things because I have lasers, I have obviously Botox fillers, PDO threads. So I do a lot already, right? But if I wanted to do any kind of body treatments, I really can't do that. So my goal was to really like expand the services that we offer to offer more body contouring, weight loss, other things, cellulite treatment, things like that. But in order to do that, I need to hire like a nurse practitioner and a medical director. So my goal with Vicaro is really to expand those services and then be able to, franchise this location to really open like multiple locations under that name, which, is a goal for the future. I mean, I've done so much in 25 years in dentistry, and, I've grown to do facial aesthetics. I've incorporated both, and I'm always like pushing the envelope, right? What more can I do? What's the next thing, right? And I
Yeah,
feel
no,
like this is,
your passion
yeah,
shines through. Your passion has really brought you to a place where, I mean,
yeah.
I can't tell you how proud of you I am. It's a beautiful place, and you've positioned yourself in the market really well, a really difficult market, might I say, because Miami is very competitive. So,
Yeah.
I'll close off with, for those that are listening who are in the beginning of their journey, what would your advice be on how they should approach this? What should they be immediately thinking about doing? What's the main, so we touched on some of the things, but what would your advice be to somebody that's listening, that's excited to maybe integrate this into their dental practice?
Yeah, I would say don't be afraid, right? Because I feel like we're venturing into a different realm, which is skin, but it's still the body, right? And if you're doing it with the purpose of like really helping and healing, because even though, yes, we're doing cosmetic treatments, we're improving the quality of the skin and we're healing the skin. So if you're looking at it from as a healer, right? Healing the patients, improving their quality of life, and then really what is that going to take? And bottom line is education, right? You have to educate yourself, and when you do, don't be fearful of taking the next step, going into the office on Monday morning and doing it, right? Because I see so many people that are just like, oh, I don't know, I'm scared. Don't be scared, just like jump in with 2 feet, because if you get the knowledge to do things safely, you could really like learn, and don't feel like you have to do everything right from the beginning. Just, start with a little Botox, do fillers in the safer places, and then, like, as you get comfortable like inserting the needle in certain places, see what the reaction is. Then you kind of like go and like take another course, take D2, and like, just do it, like stage it out, because this is, our careers are like 25 years plus, right? So I didn't like 13 years ago, I wasn't doing what I'm doing now, right? So every year I'm still learning, I'm trying new things, I'm tweaking little things, and it's a constant journey, and it's beautiful. I love it. I love teaching it, and I think it's just amazing.
Thank you for sharing your pearls. Thank you for sharing your journey. Appreciate you so much. Thank you for being here, and
Yes.
happy 25th anniversary, Dr.
Thank you.
Hernandez.
Thank you.
All right.
Appreciate
Thank you. Have a
it.
wonderful day, and I'll see you soon. I'll be at your practice.
Absolutely. Thank you.
All right.
Bye.
Thank you, Dr. Hernandez. Bye-bye.